Welcome to the Sky News Daily Podcast with me, Dermot Murnaghan. Thanks for joining us as we examine the story beyond the headline. Well, now, as the Health Secretary put it, for many of us, 2020 has been a year to forget. But before we consign it to the archives of history, let's take a look at the good, the bad, and the remarkable moments we've witnessed.
They're fighting a war here and they're losing.
A disaster, a tsunami.
It's a recurring theme now. Everyone dies alone.
You've got masks, gloves, overalls. They've just been left there.
Can you level with us? How many people do you think will actually die?
You must stay at home.
They're going to do everything they can to save him, but the odds are stacked against him.
I don't want to be a statistic to this.
Who you are, it takes you down.
Boris Johnson has tonight been admitted to hospital.
I just got better, and he didn't.
This used to be a theatre. Now it's just a storeroom.
We're having to struggle to get this equipment in place. It's appalling, really.
I wonder if you will take this opportunity to apologise.
A first for British Muslims. 10 burials, one straight after another.
It's the biggest day that we've had in terms of falls since 1987.
I've got to get out, I've got to get some fresh air.
I can't take this anymore. I can't go on.
I'm sick and tired of this. When is this going to stop?
They ruined my results. This is not what I deserve.
You can see him just there, running across the Downing Street and out the back gate.
How is it?
Hell, biblical.
It just brings a little bit of joy to a lot of people at a time when that's exactly what they need.
You really want to give people a hug every now and then.
This is a day to remember, frankly, in a year to forget.
It's all for Britain, that's right.
Hopefully it'll help other people come along and do as I did.
2020, what can we say? What a year. With me to reflect on the challenges humanity has faced, I'm joined by our science correspondent, Thomas Moore, and Ashish, Joshi, Sky's health correspondent. Good to see you guys. And, I mean, your feet haven't touched the ground this year, have they? And I'd like to actually start this as a colleague and indeed as a viewer and listener to thank you both for how you've talked us through this crisis. You know, your cogent, clear, and I think really important, your calm analysis throughout what has been and is going to be an extraordinary few months. Right, praise over. That's the last you can. That's enough of that. Let's just rewind. And Thomas, I remember when this all started. I mean, it seems a million years ago. You were in the Antarctic.
Yeah, so I was on a boat with the British Antarctic Survey, and we got a news sheet every day sent by satellite, and I could see early January, this short one-paragraph mention of a virus. And as the days went by, that news story got bigger and bigger and closer to the front. And when I got off in the Falklands in early February, it dominated the front page. I knew what I was walking back into, and so it has proved to be the most awful year.
What about you, Ashish? Hadn't you just started in this post on this specialism?
Yeah, I had. I'd just been asked to take over the health brief in, I think, October. Then I was off in November. I was sick myself in hospital. Came back just in the middle of January, and I was told, you know, I'd have a nice, quiet Monday to Friday, 9 to 5 brief. And I remember the first day I walked back in, this unknown virus from Wuhan in China. 19 hours later, I left the office.
And here we are. Well, let's remind ourselves of perhaps the journey that led us to arguably the greatest scientific achievements of this pandemic.
All the time, we've been waiting and hoping for the day when the searchlights of science would pick out our invisible enemy and give us the power to stop that enemy from making us ill. And now the scientists have done it.
This is a day to remember, frankly, in a year to forget. We can see the way out of this, but we're not there yet. So let's keep our resolve, keep doing our bit to keep people safe until science can make us free.
Hopefully it'll help other people come along and do as I did, you know, try and do the best to get rid of this terrible thing.
Let's look now at the vaccines. Thomas, it's almost impossible to believe that we hadn't heard, or that most of us hadn't heard of coronavirus, COVID-19 a year ago, yet here we are with several vaccines approved on the cusp of approval, and many, many more coming down the line. How has science managed it?
So they responded extremely quickly. So when the Chinese released the genetic code for this new virus, they leapt on it. Within 2 days, they'd isolated the bit of the genetic information, those instructions for the spike protein. They all decided this was what they were going to aim for because that's what latches onto human cells. That's how it starts off the infection. Makes sense to target the vaccine at that. And that's what they did. Robin Shattuck at Imperial College, one of those developing a vaccine, within 2 days, he had something sketched out on the back of an envelope. Within 2 weeks, he'd actually assembled a working vaccine. But it then takes time to see that through clinical trials just to prove that it's safe and effective.
Yeah, but Ashish, I mean, still so many questions about the vaccines. Yes, they've been through the clinical trials and we got these 95% efficacy rates, if I can say that correctly. But, you know, it's further down the line, isn't it? And because the coronavirus has only been around for 9 months or a year or so, we just don't know how long they last and things like that.
These trials will continue alongside the rollout. Behind the scenes, you'll still have scientists working and reworking every iteration of the vaccine they're working on to make sure that it is as effective as they think it should be. And the fact that we've got to this stage right now, at the beginning of the rollout, where we have some vaccines with a 95% efficacy, now that's a pretty good place to start. There will be, and what will happen is they'll share this expertise with other developers. They'll be learning, they'll be sharing, they'll be swapping. So as we progress further down the line, in the next few weeks and months and into next year, these vaccines will only get better.
But isn't part of the excitement of all this, I mean, something really remarkable might emerge, not just dealing with coronavirus, which, you know, let's be honest, isn't the most deadly of diseases to entire populations. That this might be applied to something like malaria or something like that.
I think you're absolutely right. This has opened up a new chapter in medicine. These new genetically based vaccines have been developed extremely quickly, and they also seem to be breaking the old rule of medicine that older people tend to respond less well to vaccines. They are responding just as well to these new RNA and vaccines that have been developed by 3 companies now, and there are more coming on behind, and that's really exciting.
What is it they say? Necessity being the mother of invention and all that. So, OK, let's not forget the impact COVID has had on all our lives and the devastating consequences for some much more than others.
I've been to hell and back. It's not been nice. It's a hard road, and it's a slow recovery. It's so evil, this thing. It doesn't care who you are. It takes you down, and it really, you struggle to beat it.
I didn't care whether I lived or died. As a matter of fact, I expected to die, and I thought it would be a good thing. And afraid to God that he'd take me. I don't want him to take me now.
When she left this house going into a coma, that was the realisation of how serious it was. And I was nervous that once she'd left this house, she wouldn't come back. And that's ultimately what happened. I couldn't even be there to hold my mum's hand. Do you know what I mean? And that's something that just burns me for the rest of my life.
Well, that is the human cost. And I think we should all reflect, first of all, shouldn't we, Ashish, on the numbers here. 65,000 people in the United Kingdom have died with coronavirus and counting. And indeed, that might not be a fully accurate figure.
It's such a desperately lonely, heartbreaking disease. You literally are next to somebody 1 minute and they go off and they see their loved ones being wheeled off into ambulances. And that's it. That's the only contact they will have had with their loved ones. I spoke to doctor after doctor, nurses, all the healthcare workers, and they said that they are used to seeing people die. That's what they do. This is their job. Sick people coming to hospitals. The one thing they couldn't deal with was the fact that loved ones were separated at the time of death, and it was brutal for the people who had to go through that.
Thomas, and I mean, it's not just about COVID-19, coronavirus and the response to it, and in particular the necessary NHS response to it, it's had so many knock-on effects, many of them we won't be aware of for many years. So at the time of recording, I hear today, you know, just about the number of cancer scans that have to have been forgone because the NHS can't deal with everything at the same time?
There are going to be several long-term issues that come from this. One, of course, the economic ones, which we can't ignore because that has health consequences in itself, long-term unemployment. But yes, the other conditions, the many people who will have died from stroke and heart attacks and cancer, who would have survived in normal circumstances but haven't got the care they needed early on simply because the NHS has been focused on trying to save those with COVID. And I think that's going to be a big issue. And then, of course, we've got long COVID itself, this emerging chronic after effect of the disease itself, where the virus seems to just wreck the organs, and that comes back and haunts us many years later.
But away from that as well, we've got the mental health impacts. I mean, how are we going to quantify those?
Huge.
The loneliness
We are only, even now, scraping the surface as far as the mental health impact on people who have had COVID, who have known people who have had COVID. It goes on, and I think we're not going to know about that for months, if not years, Dermot. The mental health impact is going to be huge.
And Thomas, just expand on long COVID. Again, this could go on for, well, I mean, it could be a condition that, you know, eternally affects people. It could alter their lives.
Yeah, I mean, there was some research the other day which showed that the virus is causing an increased risk of heart attack, of dialysis, kidney failure, of diabetes and so on. It gets into the organs. The ACE2 inhibitor, receptor rather, which is on the cells in the lung, are also found elsewhere in the body, and that's how it's getting into these cells and causing these long-term problems.
One of the people who we heard from in the clip there, Tom, I went back to see him 3 weeks after I interviewed him in an ICU. He answered the door in a wheelchair, and he says he still has blood clots, his lungs are messed up, he can't walk, he's out of breath, he can't perform ordinary everyday tasks. He's in his 50s.
Yeah, it's the young as well as the old, and I think that's the shocking thing. I think it's really woken up a lot of people to the consequences of having this virus. Even if you don't see yourself at risk of death, you are at risk of long COVID.
So a year on, what more do we know about COVID-19?
We don't know the source of the outbreak. We don't know what its natural reservoir is, and we don't properly understand its transmissibility or severity. To defeat this outbreak, we need answers to all those questions.
The scientific advice is clear. Acting too early creates its own risks. So we will do what is right to keep people safe. Guided by the science, we'll act at the right time, and we'll be clear and open about our actions and the reasons for them.
On one side, we could cause enormous, unnecessary economic and social damage, people being isolated, all the unemployment, all the things we read about in the newspapers rightly, and steer too far the other way, and we end up with the epidemic coming back and a second spike. Walking that path is extraordinarily difficult.
So let's talk about the science. Thomas, I want to start with that. You know, we've heard that phrase so many hundreds of times, at least, guided by the science. But if you've been telling me on the daily podcast, on air, on Sky News, you know, science is not an absolute. It's not written in tablets of stone. It has to be tested all the time. And we have learned so much during the course of this pandemic about COVID-19.
Yes, and I think scientists have been too, and that's the point. As this was a new emerging virus that had never been seen in Europe before, and people really didn't understand it at all, not just on what it was capable of, but on how we should deal with it. And so there was no one science. There were lots of scientists with different opinions on the way forward. And there was an evolution in the understanding. So at first, the feeling was that masks may actually increase transmission because you're touching, you're taking your masks off, and there was no good evidence in the early stages that they would work. Now I think there's much better evidence that they do on balance of everything. So I think that's just an example of how really scientists too have been learning about this virus, and they would still say they don't know everything they need to.
And Ashish, in terms of who it badly affects, we learned pretty quickly about the elderly, about ethnicity. Very interesting there, some of the work that you've been doing on that. Obesity, having underlying conditions like diabetes. We've learned so much in those areas.
Yeah, but it had to be learned the hard way. Yeah. I mean, that was done... these weren't people who were identified as, before the pandemic started killing people. They were identified when the modelling and the data was collected, and that's when they looked at the figures and thought, oh, OK, this is affecting people in this cohort, this is affecting people with this comorbidity. And that's when you had, probably that's why the government were criticised for not acting decisively right at the beginning, not to protect the care homes, not to protect the vulnerable, not to protect those people with underlying health conditions. These were things which were having to be learned literally on the job, and that's why there was so much early criticism.
And Thomas, I suppose other things we've learnt during the course, or the scientists and the medical professionals have learnt during the course of the pandemic is, we've talked about vaccines, but treatments as well for people who've got COVID-19 badly, and indeed prophylactics, vitamin D and things like that people have been discussing. And what we always did know, the role of hygiene, the hands, face, space.
Yeah, it's all about social distancing. If you create an air gap between people, then they can't transmit the virus so well. And that's still the number one way of dealing with this in terms of public health. In hospitals, there have been great steps forward. The recovery trial that the NHS has been running has been world-leading, and they were the ones who showed that, for example, dexamethasone, the steroid, can have a massive impact on death, reducing the risk of death in the sickest patients by a third or so. And that, I mean, if we hadn't had dexamethasone, the second wave would have been a lot worse than it really has been.
But one thing, I mean, just to throw to both of you, Ashish come in on it first, is, in terms of what we haven't learnt as societies, is how to respond. Yes, the medical treatments, the vaccines, the actions, the personal actions. But, if you look at particularly this second wave and the third wave, it's that some of the countries that seem to be doing quite well early on are being affected just as badly as those that took a different approach. There is no one size fits all.
No, definitely not. I mean, Thomas went to Sweden early on, and that was held up as a model. Everyone looked at the Swedish model. Let's do it the Swedish way. Let's not have a full lockdown. Look what's happening there now. So, no, I don't think any one country, everywhere, the virus has rebounded.
Yeah, I think Asia has done really well because they had seen SARS and MERS. They knew how to deal with these viruses, and it did come back to testing and tracing, isolating people who had the virus, who'd been infected. And that is the best way of dealing it in the absence of a vaccine. They took the coronavirus much more seriously than any European country did. They didn't comprehend that it could cause a problem over here. The assumption had always been in Europe that it would be flu that caused the next pandemic.
And also because in those societies you have societal compliance. They knew exactly when this virus is spreading, this is how you deal with it. You put on a face mask and you quarantine. And over here, it was, look, this is a disease in the Far East. We don't have pandemics like that over here. We have high standards of hygiene. Look at what's happened to us.
Yeah, you just wouldn't have believed that you would close down whole economies in the Western world. I mean, you can kind of believe it maybe in China, but in a democracy? No, people wouldn't have believed it, and yet we've done it twice now.
Well, listen, it's not all been doom and gloom. The pandemic has brought out some of the best in humanity. Here are just a few examples.
Doctors coming out of the hospital, clapping to one another. That was what moved me most. But seeing pictures of people out of windows and then all like in high rises, and you hear all that sound, and you basically just hear that emotion coming through. That is, that moves me a lot.
We've never had anything quite like this before. We've suffered with wars, but this is it's a global thing, and as we said before, it's invisible. We will get through that. I think everybody got to remember, we will get through eventually.
We should take comfort that while we may have more still to endure, better days will return. We will be with our friends again. We will be with our families again. We will meet again.
Well, prescient words there from Her Majesty. That was back in April, saying that better times will come. But she certainly knew we would have more to endure from that, and probably more to come now. But those uplifting moments, well, we've got to start with, I guess, the clap for carers. And maybe Sir Tom, I was going to call him Captain Tom. Sir Tom, standout moments.
Inspirational. That's exactly what you need in a time of crisis. You need somebody like Sir Tom to say, do you know what? I've been through a lot, And I'm sure that if we all come together, support each other, we are going to come through this again. And the way people rallied, not just to his cause, but to other common causes, you know, people working in their communities, leaving food bags on the doorsteps of those vulnerable people who were shielding. Incredible, incredible selfless acts.
Here's the big question. I think it'll last, though, this sense of community. That's what, you know, people want, but you tend to revert back to what it was, don't you?
Look, I applaud those people who've gone off and found themselves during this pandemic, sometimes because they've had to, they've lost their jobs, and they've gone and reinvented themselves and stepped off the rat race and found something that they really love to do, not necessarily for money, but because it's something they really do enjoy. And I hope that that survives.
We've seen recruitment figures for nurses, doctors, scientists, all of those going through the roof now. So if there has been something good to come out of all of this, is our respect. And look, you know, science is sexy now, all right? People want to be scientists. Thomas is sexy now.
Yeah, imagine that.
But there are children now who understand, you know, what an impact being a nurse or a doctor or a care worker or a scientist can have.
Thomas, I mean, does it make you look at things differently? Look at your family differently? Look at, you know, the fresh air differently? Look at a restaurant when it opens differently?
I value everything that we've lost in the last few months. You know, I haven't hugged my parents since February, and that hurts because they're, you know, getting on. My daughter has been messed up. She's one of the A-level people who had a difficult time back in the spring and now having a difficult time going to university. So I've seen it up close. These things have mental health consequences on everybody, and that will take time to heal.
And that is the point, isn't it, Ashish, that it's touched absolutely everybody.
This has been a pandemic which has reached into every single part of our lives. There is nothing which has been left untouched. And, you know, yes, you can look back on the year and look back and say it's been terrible for so many people, but I can actually look forward to say I will look at the world with a new sense of wonder and awe, because I will realise that there are people there who can try and make sense of all of this for us.
Ashish, Thomas, thank you both very, very much indeed. Now back to work. And that's it until next time. Head to Sky News for the latest on the COVID fight back.